Welcome to Highly Therapized, an in depth exploration of mental health topics, unpacking them one layer at a time. I'm your host, Jenny Petersen, and today we have on once again Dr. Lockhart. We're going to be discussing the supervisor seat, power, pressure, and purpose in the therapy spaces. Dr. Lockhart, do you want to once again introduce yourself?
Absolutely. Thank you so much, Jenny. My name is Dr. Ezra Lockhart. I just think I cracked 20 years
Oh
here in
my
the
gosh.
field for both mental health and addictions counseling. I've been a professional supervisor since 2002 and an adult trainer since 2015. I am board certified both by the NBCC, the National Board of Certified Counselors, and the AAMFT approved supervisor, which is the American Association for Marriage and Family Therapy. And see, I want to say like maybe the last 7 years, I've been really dialing in on my clinical supervision, and I
Mm-hmm.
do case conceptualization for autism spectrum disorders, ADHD, substance use disorders, process addiction, and risk and suicidality. I'm
Yeah,
the founder and clinical director of Easy Does It Counseling, and we service Alaska, Colorado, Hawaii, and Louisiana. So 4 states right now.
that is awesome. And congratulations on 20 years in the field. That is amazing. And I can definitely
It
tell
creeps
that,
up on you.
yeah, I can definitely tell too that you're super passionate about supervision, even just from our last conversation. So I'm super excited to talk more about this. And I think it's a super needed conversation, especially for unlicensed therapists in the field who they just don't know what are what does it even look like and what does supervision feel like. So first, I want to get into the foundations of supervision and what makes a good supervisor.
Certainly, having some experience in the field is a good start, so you can speak from that experiential base. And to your point, supervisees and those early in the field, you don't know what you don't know. So being able to hear from like a mentor or supervisor who has been through it, like been there, done that, they can share those stories and give you a bit of the lay of the land um, instead of you going out just into the wilderness. So some experience base, but I think being able to teach is really important, um, and being open to feedback as a supervisor. I think those are really important.
Yeah, and something I think about too, with what I've seen in community mental health is like they'll put a just freshly licensed therapist and make them a supervisor, which we know that even if you have supervision with them, more than likely it's not going to count towards your hours because you have to be approved by the state. And so, how do you feel about um, freshly licensed supervisors providing that supervision?
My experience has kind of been in two places. The first one is it's actually not standard across the states here in the U.S.
Okay.
So it's not like each license requires a supervisor designation or specialized training in order to
Mm,
sign off on someone's hours. And I think that's a bit of a hitch because you will find, as you find in nursing, I supported a nurse for a while, and she would explain that in nursing there are those who want to practice, like they want to be working with clients and patients, and they don't want to really be doing any admin anything. And then there's those that kind of get like forced um, into this admin position where they're not really practicing anymore, but like hospital administration is super important. And I feel like with our field, it's one of these things where either there's this gap and there is no like designated supervisor, and someone just by tenure or
mm-hmm.
competence kind of gets scooped up and made to do the task, versus this very intentional. We're hiring supervisors, and those who have supported not just the administrative function, but the clinical function.
Right. And so, would you feel like it's then good practice for those unlicensed therapists to maybe interview a supervisor if they have the choice of picking one?
Absolutely. So
Yeah.
first off, there's a lot of folks. There's a lot of folks that I'm gonna clear some stuff up. Let's do that. Um, a lot of folks don't realize that there is a distinction between an administrative supervisor and a clinical supervisor.
Right. Yes.
And when
Thank
you
you.
look at a right, when you look at a lot of the codes of ethics across the mental health professional agencies, they talk about dual and multiple relationships. But this is one of those dual and multiple relationships that rarely gets looked at,
Mm-hmm.
and corporate structures will just by structure and necessity will create this conflict where the person who is supporting your clinical skills and development and your case support is also the person who is doing your performance evaluation, um, tracking your attendance, and it creates a conflict. It creates a
Yeah.
conflict when you have to give feedback that really doesn't, or feedback and support that really doesn't um, show up within the therapy room. I think that's a good way to think about it.
Mm. Yeah.
Um, but that's the field. That's the field, and what you'll find is, and this is the second piece, is a good option. You can get external clinical supervision.
Right.
Some agencies, yeah, right. Some agencies will give you a stipend, or they'll pay for it, um, or you can pay for it yourself. And I think it's a really good idea, to be able to have this third party, like outside of your organization, who can support you without having the conflict of interest of being within your company.
Right. So, when someone is looking for that supervision and interviewing supervisors, what do you feel like would be good questions? Maybe one or two that you can think of off the top of your head of good questions to ask a supervisor just to kind of get that feel of if it would be a good fit.
Oh, yes. So, first, definitely feel the presence, right? Like, this is a person you're going to be meeting with weekly for who knows how long, right?
Yeah.
And being able to sit in their presence and feel like it's supportive is really important. The first question I would ask is, how do you give feedback? And not the everyday cheerleading stuff, but the, oh my gosh, something might be wrong
Hmm.
way, right? So asking, how do you, like, if I came to you with a problem, and it like potentially your license would be at stake, what kind of feedback would you give me? How would you deliver that?
Right. Maybe how would you support me?
Absolutely, absolutely. Um, so that's a good place to start.
I like that one.
Um,
That is a really good
yeah,
one. And I think just to add to that, like your supervisor should be seeing the ugliest side of you. And what I mean by that is that they're going to be seeing the countertransference, the transference, and then the just the yuck that we go through as therapists of feeling the depth of our clients and carrying that with us. And at times, sometimes we have to have those conversations that push us to make us better therapists. And sometimes that is the yuck.
glad you said that. When I think about my past 7 years doing this, I shifted my approach. When I first started, I wanted to keep the professional and the personal separate. And I
Oh,
operated, yeah, right. I
yeah,
operated on this premise that this is an adult, they are professional, they will handle their personal life, they will keep it outside of the therapy room, outside of the our supervision, and we'll work on the counseling stuff. And this isn't their therapy session. But then I went through the AAMFT core training, which is, oh gosh, I forget how many hours it is. It's like maybe 40 of coursework, and 40 observation with I'm sorry, 40 in class synchronous with 100 observation where they're supervising your supervision. And AMFT is a big proponent of self of the therapist, which is
Yeah.
this idea that you cannot divorce yourself from your work. Like whatever you bring in, um, you're going to have not just transference and countertransference, but there's going to be an isomorphic effect. And I know that's a big fancy word, but what isomorphism means is the dynamic that you see in your client's system can be reflected in your system. So, for example, if your client is going through a divorce and you have gone through a divorce or are going through a divorce, you have to consider that in the way that you support them because you might be biased, right? You might
Yeah.
be taking on a particular role within that other structure, that other system, and reflecting that in your woulda, shoulda, couldas. Um,
Yeah.
so yeah, so I shifted. Gosh, I don't remember how long ago that shift was. Pretty recently. I'd say maybe three
Oh,
years.
wow. What can I
Yeah, I
ask
shifted to the subject line, please.
what do you feel like kind of contributed to that shift? Other is it just that course or were there other factors involved too?
Nope. 100% that course. I
Really?
was
Okay.
really I was rigid. I was like, no, 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 these are adults. Like, and I would say things like, I trust in your ability to handle that. Um, yeah, I trust in your ability to handle that. And I think I closed the door um, on certain supervisees. But it wasn't until I took the training that I was like, wait, hold on. Like, it's a lot. Like, it is a lot to compartmentalize
Mhm.
your life.
Mhm. Oh,
And
absolutely.
right? And when we talk about effective client care, it also means effective self-care or care of the therapist, the healer.
Mhm.
And self of this therapist is very affirmed in that premise. So if a person is unhealthy, right, it's going to show up in the work. So why not support a person in being able to acknowledge those things, and like navigate it in the therapy room as they're navigating it in their personal life.
Right. And I
So yeah, yeah,
I feel
it's
like you and
it's
I
great.
kind of are on the same page, like no matter what, we're people too at the end of the day and we're going to be going through rough stuff. I can't tell you how many times I've met therapists who are also in abusive relationships themselves and then also practicing therapy at the same time. And so how do you integrate that this is what you're going through and also support your clients?
It's a good point. It's actually a thing that in my practice I do, which is I ask contractors and or staff, what are populations that you shouldn't be working with?
Mm.
Instead of, who are you willing to support or not support? Who shouldn't you be working with is a good question to ask yourself. And if you arrive at a particular population or a particular condition because of something in your history, being able to self monitor, get support in self monitoring, and pacing yourself,
Mm.
especially limiting or being real strategic about your exposure, is really important. For instance, I've got some rules on how many, I won't name what type of client, but whatever type of client is, I only see one a day, to
Oh,
just make sure that
yeah.
I don't get overwhelmed or I'm buzzing too much going into another session.
Yeah. I
But
think
but
that's
that's the kind of thing. Oh, go ahead.
Well, I think that's a great way for supervisors to help their supervisees also manage that, and I know that can be hard in certain settings, but it's definitely a good practice to have. I mean, your whole licensure and career as a therapist.
Yes, and I think this is something that corporate structures should take note of,
Yeah.
which is interdepartmental, intercollegial transfers, right? Like if one person is the trauma specialist, we shouldn't be taxing them with only doing the trauma work,
Right. Right.
right? Like, and that happens. That happens. Oh, so someone's got a specialty, then we're just gonna um, send it all your way, which some people can handle. But being able to have a break, have be able to monitor yourself and say so, like say your needs around those caseloads are important, and a lot of folks are don't know that they can ask, right, or that they should be asking for support.
Yeah. Well, I want to say also, like, I'm so impressed with you that you were able to change that kind of black and white thinking of this is how supervision should be, and it just shows how much growth you've had as a supervisor. And I also wonder if that could be another question clinical trainees or unlicensed therapists can ask their supervisors, like, what growth have you had in your career as a supervisor?
Great question. Yes, and you can ask them what their clinical approach is. So
Mm-hmm.
with isomorphism, it also encapsulates that when a supervisor is supervising clinically, they are often, and sometimes it's unknowingly, they're using whatever clinical orientation they have or treatment modality they have. They're bringing it to the clinical supervision. So if you have someone who has no idea what EMDR is, does not use EMDR, and that's your preferred modality,
Mm-hmm.
it's probably not going to be a good fit,
Yeah.
right? If you have someone who is doing CBT and you're a CBT person, you might just align because you guys are going to be talking the same language. So that's important. But also, like, what's your supervision style?
Right. I think
Do
these
you have
are
any
all
formal? Go ahead.
like I think these are all just really good questions and things to keep in mind for what a good supervisor looks like. Is there anything else you would say that makes a supervision look good or feels good? Is there anything else that you would add to this?
Absolutely. And it probably should be the number one thing, going back to a thing you said earlier, which is make sure your supervisor is actually licensed and approved in whatever way your state does
Mm.
it. I, ooh, I have a story in which all of a sudden I had a whole bunch of phone uh, calls in for folks looking for external supervision because the state of Colorado had updated their statutes and specifically had requirements for clinical supervisors, and it was not, or it was implemented retroactively. So anyone who hadn't submitted their work verification forms with their supervisor's signature,
Hmm.
their supervisor would have to meet these standards.
Oh wow.
And yeah, and there was a lot of folks who were at risk of losing almost 2 years worth of
Oh,
work. Yes, so I got a
horrible.
whole bunch of calls, which was great. Great for me, but not so great for for folks. So it's one of those things where you should be aware of your Mental Health Practice Act within the states you operate. You should understand how they define a supervisor, and then make sure that your supervisor is actually qualified, especially if you're working at an agency and your supervisor is just assigned to you.
Yeah, I think a prime example of that is I know in Minnesota, I'm an LPCC, and when I was getting my supervision hours, I could be supervised by any license. But I think I don't remember which license it was. Maybe it was LMFT that they had to be supervised by an LMFT. Don't quote me on that one, but I know that there are certain
No, that's
licensings
real.
out there that yeah, it has to be that specific license too.
Yeah, and you will see that in the Mental Health Practice Act for the state. It will say who can supervise who, and there are some states that allow some cross pollination, where maybe like a licensed psychologist can support an LPC.
Right.
So yeah, it's a thing that you want to look for. So LMFTs, so marriage and family therapy, as well as social work, are certainly two of the professions that have strong professional identities, and you're most likely going to have to seek supervision from someone who's licensed
Hmm.
within that profession.
Right. And that's super I feel like that's information that should also be provided by your college too, to check in with.
You would be surprised the
Really?
huge chasm that's between academia and each state's mental health practice.
Wow.
You would be surprised. I mean,
Wow.
I'm sure you experienced it, and maybe you're not surprised.
Um, I think that my program laid out a good here's what you need to do. But I definitely when I graduated and then was getting my hours, I felt like there was definitely this gap and I felt like I was swimming in an ocean alone. So I
Yeah.
definitely checked, check your licensing board information on their website.
I was surprised how many graduates approached me without even applying for the state board license, believing that they could practice therapy.
Hmm,
That as soon as they got their college degree, it was like, okay, cool. I've got my master's. I can practice, and I'm glad they did knock at my door because if not, it is a crime in most states. Most states,
really?
it's a misdemeanor. Yes, or
In
it's a
minute Well, I
go
know
ahead.
my experience was I graduated college, got a job, and started like practicing. I didn't have to do anything with my board. And then once I got all my hours, and that's why I mean, like, that's why I felt like such like a little fish in a big ocean because I'm like, why is the board not monitoring me or anything? And
Sure,
I got
sure.
my 4,000 hours, and then I applied for my license, and then I popped up as a real person to them. Before then they didn't even know who the hell I was.
Yeah, yeah. Well, it's interesting because Colorado has like both of them. So Colorado for the addictions counselors, your first 1,000 hours, you're not board supervised. Like
Hmm.
you don't have to get a permit. You don't have to do any application. You just work for your 1,000 hours, which is normally volunteer, and then like a licensed addiction counselor or an agency signs off on your hours, and then you start working towards higher licensure.
Oh wow.
But the like marriage and family or LPC, you have to apply for a permit, a 5-year permit,
Hmm.
and then you your hours are collected only under your permit. So if you had hours before, um, it doesn't count.
Really?
Um,
Okay.
some states, well, that's the thing about it. This is, I mean, we talked about this in the last episode of the podcast, which is there is this patchwork of legislation from state to state. So don't take for granted that the way you know how your state works is operating in any other state.
Right. And I think
Because
just
yeah,
another thing that makes a supervisor great or good is that they are knowledgeable in what you need to get licensed. I have met some supervisors who are like, "Well, I don't know how that works." And I felt very like again in that ocean alone and on me. And I think it's really great when you have a supervisor who has that knowledge and keeps up to date with that so you don't feel so alone.
thank you for saying that. I feel like it's one of the foundations of my practice.
Yeah.
I mentor for legal literacy, and I have an article that was published online. What is it, February of 2025? Mentorship and clinical supervision through Haley Strategic Model,
Mhm.
a composite case study in legal literacy. And that's through the Journal of Systemic Therapies. And it hasn't been added to an issue yet, so there's the advanced publication online. But who it has come in handy, and I've seen saved a lot of supervisees heartache in being able to interpret the law
Mhm.
and make sure that you're practicing effectively. Because I think it's a thing that again is within that chasm between graduate school and licensure, working towards your licensure, which is the like orienting you to the practice. Sure, universities help you with competency, right, and scope,
Yeah.
but what they're not connecting to you to is this um, government framework, like the state framework and what that means. For instance, I tell every single supervisee that I have what the role of the board is, which is The state board is there to protect the consumer from you.
Yes.
This is consumer protection. So when the board is allowing the an outlet for there to be grievances and or complaints about your performance. And a lot of folks, it doesn't quite click that that's why they're there. They think, oh, well, that's where I go to go get licensed. And I just got to jump through their hoops and then I can start practicing. Well, that's it in part, but they're there for oversight and they're there also to ensure that there's a taxation of your work because you are providing a service
Yeah.
um, that needs to be regulated. Yes.
Yeah. Like the provider tax I'm thinking of.
Oh yes. Oh yes. It's real.
Is there anything else that you could tell us about the Haley's strategic model?
Oh, nice. So as I was explaining earlier about isomorphism, the therapeutic modality of your clinical supervisor is often what they're going to be um, like reflecting in their process of um, supervising you. So my my clinical orientation is the pure Haley Strategic Family Therapy. I am the foremost scholar practitioner of strategic family therapy from the Washington School, which is where um, Jay Haley and Chloe Madonis separated from the West Coast, moved over to the East Coast, Washington, D.C., and started this school. And the approach is very different than most treatment modalities. So it's fair to say that there's a large portion of therapy that is passive, in which the therapist is not an active agent or an active change agent. And in Haley's model, you are directive, you're an authority. And it's an interesting position to leverage when you're providing psychotherapy. And I and when I apply that to clinical supervision,
Hmm.
I find it very effective in being able to establish a hierarchy and provide support in a way that has a definitive direction.
Yeah.
And then I kind of balance that out with this training element in which I'm I'm accepting feedback, um, I'm supporting the counselor in training in just that training, right? Like, how would you problem solve this? What do you think you should be doing? And then help with some guidance around that, giving examples. So it's this directive approach, but also a teaching approach.
Yeah. Yeah. I mean, personally, I really like that. Just because I don't also want to beat around the bush. I'm a very blunt person, and I just like people to be blunt to me as well. And so, to me, I think that sounds great. And it sounds like there's other models that supervisors could follow or do follow for their own supervision and how they conduct themselves.
I think if you are, well, certainly if you are nationally certified as a supervisor, you're going to have a model and a way that,
Right.
like in a standard way in which you do it. But as we had talking about earlier, there are some therapists who find themselves in the role of a supervisor, and it's less formal and less structured the way that they do it. So that might be a question that you want to ask your supervisor, right? Your potential supervisor is there a standard model that you do or that you use while you're supervising?
Yeah. And I know there's also like, ethical decision making models, and then like legal decision making models too, and then how do they integrate them as well into your own supervision
Yes.
when making those ethical dilemma situations and answering those questions.
You bring up a good point because that is certainly one of the aspects and functions of clinical supervision. Sure, you're mentoring and you're evaluating and supporting the growth of clinical skills.
Hmm.
Yes. But it's those ethical dilemmas and legal dilemmas that come up that you are often scrambling to take care of, especially if you haven't seen it before.
Oh, yeah.
So having a supervisor who has worked through some really tough, nuanced situations, you're gonna like it's gonna bode well for you if they have that experience.
Yeah, and not two ethical dilemmas are going to be the same, or legal dilemmas or things like that. And so you have to have those like frameworks in yourself and teach those frameworks so that they can carry on into their own practice on how to do that.
Yes, yes. And the the reason why I like the mentorship apprenticeship framework is there's a mutual teaching. So as you both, as the supervisor and the supervisee, are working through issues, there's this experiential learning process where you're learning by doing, and being able to have someone alongside you working on an issue who can peel back the curtain and say, this is the process, this is why we're making this decision. If this decision or if the situation was different, we would do it this way instead of that way. But providing some more like contextual support to why you're doing it this way instead of just focusing on some directive, do this, and then you walk away, which I think a lot of early career clinicians experience,
Mm,
where it's so fast paced, you're doing so much, you might be in a bit of a panic, just you want to resolve it, that there isn't this reflective process that's occurring.
yeah. Yeah, sounds like a balance between reflective and then also directive. And it, correct me if I'm wrong, but it also sounds like there's that opportunity for the clinical trainee to say, "Hey, this is what I'm thinking. What do you think?"
Yes, and it's part of my model, which is like to effectively problem solve and come up with creative problem solving, that you need to allow the person to think about it. So for instance, Haley's strategic model has a whole bunch of interventions that are not not very standard. So we have the concept of circular causality, Socratic questioning, we've got paradoxical interventions, and we've got ordeals. And it is a the through line is that the person you're supporting, they know how to do something, right? Like they know how to navigate life. They're
Yeah.
going to be a more of an expert in the problem. And if you can give them permission to do something differently, then they're going to find an answer for their particular problem. So I'm cultivating this creative problem solving skill in saying, okay, what do you think you should do? What's your gut tell you to do, right? Like let's work this out.
Hmm.
And if there needs to be some destabilizing to help a person think differently, then I'm there to destabilize.
Yeah. Sounds like a really good model for many therapists to check out.
Yes, yes.
Well, I would like to kind of move into the clinical trainee, since we've been talking about the supervisor so much. How do you know when the clinical trainee is not a good fit when you are in the seat of
Mm.
the supervisor?
So from my perspective, it is about trainability or coachability. Is the person coming to you with a growth mindset? Are they prepared to learn? Are they prepared to receive criticism and critique?
Hmm.
Can they integrate that critique? And even before that, can they understand the critique? So during my interview process, I actually throw a dilemma out
Okay.
to see if they can work through it. And then I intentionally, and this is part of the paradoxical intervention, whether I'm right or wrong, and oftentimes I make it so that I'm wrong, I challenge them and give them something that is seemingly wrong and see if they give me pushback or if they can stand firm in in what they're doing. And that way I can trial whether or not they're going to be receptive to feedback, and that they can be assertive and challenge me if they don't believe what I'm doing is correct or is the right direction.
Right, right. I've seen in personal like therapy circles, supervisors talk about clinical trainees who push back on like um cultural aspects where maybe the supervisor was white and didn't have the lived experience of being a person of color, and then the clinical trainee did and was looking at those aspects. And so it's like kind of a power dynamic that you're pushing back on, and then is that allowed to be able to say, hey, like this is where I'm thinking in this direction.
In my article, in the article I was discussing, I actually um, take the reader through a case study with a supervisee of color who's experiencing discrimination. So it was
Mm,
a black woman in a predominantly white space, and really trying to open up that conversation to have some productive talks around perceived discrimination, right? Uh, and that's not always something that you can take for granted. It's going to happen, right?
right,
I think you've got to be intentional about it. And certainly in this country, like racism and talking about discrimination is a difficult topic. And if you can establish that kind of relationship early off with your supervisor and voice that that's the elephant in the room, you're going to be better off, right? So having a supervisor who it like can navigate that, who that's their philosophy, it's going to bode well. If not, you're going to have to take it upon yourself to initiate that, and you should. I believe you should.
right, right. So a supervisor who also can be flexible in that way.
Well, I think it's that growth potential that
Yeah.
I've been talking about within a mentorship, right?
And it
Can
goes
you as a
both ways.
supervisor receive that? Absolutely. Absolutely.
Yeah.
Yeah.
And unfortunately, living in rural Minnesota, I've seen it happen. And then they also become the token uh, person of color therapists.
It's all over the country.
Yeah.
It's all over the country, yeah.
Is there ever a time where you feel like, so I've heard from past supervisors say, well, I didn't pass or allow this clinical trainee to pass in their practical or internship, or I didn't recommend them for licensure. Have you ever seen that, or what are your thoughts about that?
Sure. So I have a personal value that centers on scope of practice. I have experienced a lot of supervisees who, unknowing or otherwise, take on the professional identity of another discipline. So, for instance, I have had Christian counselors or people with Christian faith um, apply for a professional counselor license and don't operate within the scope of what a professional counselor is. So
Mm-hmm.
that would be that would be an instance in which I would spend a lot of time working to support a supervisee in that understanding and then holding them accountable to it.
Mm.
If I had a supervisee that would refuse, that they're, for whatever reason, refuses that, um, then that's not a supervisee I can supervise. And I actually would terminate, like if they were already part of supervision with me, I would terminate supervision at that point,
Okay.
and I would sign off on whatever hours we had worked on, but I wouldn't continue with that client. So for me, that's a really important value for me to hold that line.
Mm-hmm.
And it's
Yeah.
also an issue of legality, which a lot of folks again don't consider. You can be a Christian counselor, or if that's your identity, then there literally is a board that can support you. So that's one. And to be quite honest with you, I would use the same line for those who are marriage and family therapists. Like when they come under supervision, we do systemic work. So the system is always in the room, regardless of who's in the room.
Hmm.
So I would support someone in that.
Yeah. Do you ever feel like there's a point of where it would be gatekeeping?
Well, first off, I think there's gatekeeping at all levels,
Right. Oh,
and
absolutely.
or yeah, for the most part, like gatekeeping has a very particular function and a useful function, but there are times when supervisors aren't aware of how much power they hold within gatekeeping and may hold supervisees to unrealistic standards or
Mm,
standards that don't actually like it's not actually the standards written on paper, it's their own standards. So that can certainly be a barrier, and doing self with a therapist's work, evaluating and monitoring your own practice within supervision is really important.
yeah. Yeah, and I think that kind of gets into the conversation of what are the boundaries and expectations of the supervisor's role.
Yeah, having discussions about that early off is really important.
Hmm.
um, I think firstly, your practice, whatever model you're using, should set some guidance on how to do it.
Oh,
You,
absolutely.
you have
Yeah.
you have formal training. You should have formal training to begin with, but having formal training and keeping up to date as a supervisor really important.
Yeah.
And like to the point of your model. If you don't have a model, grab one. Um, some or most models, it's clearly like there's a clear line drawn between you having a dual or multiple relationship with your supervisee, meaning you don't go out and have a beer on the weekend.
Right.
You're right. You draw some lines there. Similarly, as you would treat a client, right? Those kind of boundaries are really important in clinical supervision, and understanding that the clinical supervision session is not a therapy session. And that's where it gets a little murky because it does depend on what model you're using. Majority of them are not self with a therapist, and you're going to want to draw that line, that boundary, um, and have some protocols, some things that you turn to if some like um, mental health issue, some adjustment or life issue, um, like I guess impacts negatively someone's care, like your supervisor's care of a client, then certainly you're going to have those conversations.
Right. Yeah. So a personal experience that I had was during the last bit of my clinical trainee hours, I was in an abusive relationship. And, I would go to my supervisor and be fully honest, like, this is what's going on at home, and here I am at work, and how do we separate what is therapy, what's not? And obviously, I've been in therapy for some time to manage all of those things. So I think it can get really murky, but I think also a very tactful supervisor is going to know how to navigate that. And I would hope too that they wouldn't throw it in the clinical trainee's face of like, well, this isn't therapy. Why are you sharing
Certainly.
this?
And that goes back to boundary and boundary setting, right? Not all boundaries look the same.
Mm-hmm.
It's like not all boundaries is a 30-foot tall wall. Some of them are 5 or 3 feet tall, so that you can actually see an issue and like speak to it before it touches the wall. So having this huge 30-foot wall where she's like, no, I don't want to hear it. Like, be professional. It's not always the right fit, right? It's not always the right thing to do. We are human at the end of the day. We're not just workers. We're not just healers, right? And being able to acknowledge the humanity in what your supervisor is going through or your supervisee is going through, and being able to like help them support themselves in their work.
Mhm.
So for instance, if a supervisor came to me and was telling me that they were going through that, um, if I was working within the agency, I would certainly lean on the administrative supports, right? Like, is there any resources or referrals that I can give you within the company in order for you to get additional support? Do we need to adjust your caseload
Mhm.
so that you, right, that you're not exposed to this type of issue that your client is experiencing? Um, and then on the clinical side, I would have direct conversations about how you think that's going to impact the work that you're doing, and how can we mitigate that? What kind of support do you need to mitigate it? And that procedurally, like pragmatically, is not therapy, right?
Right. Right.
Yeah.
It's not therapy, and also you can empathize and say, I'm wow, I'm really that's really hard that you're going through that, and also a clinical trainee on top of things, right? So I think that's just another, in my opinion, a red flag that unlicensed therapists can look out for, is like, how are they also just being a human with you in supervision? And that isn't therapy. It's just being a human too.
Yes.
Any other boundaries and or expectations you could think of? One that comes to my mind is I remember when I would have say like a crisis session or something, I would want to debrief that same day. Or, when I was like super fresh, like probably my first 1.5 years, and I'd be like, oh my gosh, like I need to debrief. I would call my supervisor and we'd have that debrief the same day.
Are you saying that that's potentially a boundary issue?
I think for some supervisors, maybe. I think that's something that you should definitely talk about with. What does debriefing look like to you? Do we just wait another week until we talk about everything that you have? Or is there a possibility to call you after work hours to debrief? Is there a possibility to somehow fit in time during the work hours to meet? Things like that.
You should certainly set that expectation or ask that upfront. I know
Yeah.
a lot of supervisors that would say, save it for your supervision session. I, on the other hand, because I do crisis work and support those high risk caseloads, I have my supervisors have my cell number, and it's like
Oh,
text
yeah.
me, call me, uh, and because a lot of times we're working through things like, is this a mandated report,
Mm-hmm.
right?
Yep.
Like, what's the next steps here, or even the like, I need a second pair of eyes on this, and that's what a supervisor is there for. So for me, but I mean, I'll do 10 a.m. to 10 p.m. Work with clients, so it doesn't bother me one bit. I've always worked in a 24-hour setting. So, but yeah, it's a thing that you're gonna want to ask if there's an expectation that you're going to be working with high risk caseloads.
Mm-hmm.
Um, yeah, that you want a supervisor who can support that.
And maybe that's something an unlicensed therapist would have to think of too, is like, what are going to be your needs? Because if I wouldn't had, that need met, because that's what I needed, I probably would have felt like I was drowning during that time, because I needed that reassurance, like, hey, this is what happened. Are we good? Right? Was I actually supposed to call
Mhm.
the cops? Was I actually supposed to call the county? Questions that, you would make those decisions at the moment and then make sure, like, hey, let's back up that what was done and needed to get done today. We're good to go.
Yes, and like it's why this discussion is so important,
Mm-hmm.
because you really don't know what until you figure it out. Uh, and a lot of folks who are just going straight into agency work, they really rely on the institution and the structural supports in place that's going to support them. But a lot of times it is like there's a lot of onus on the individual, even as a trainee, and we know that you don't know what you don't know. you're somehow expected to give it your best shot, the good old college try. And if you fall, not even having a foot from the goal, oh well, that's on you. And that's certainly not an approach that's supportive, but it's very common.
Yeah. Another thing I wanted to ask about to you with all your extensive experience, that's just something that's coming up more and more, and I think is a great conversation for boundaries and expectations of supervision is should supervisors monitor supervisees' professional content online?
Professional content online. That's an interesting.
Yeah. And I can be
Um,
more specific if you would like an example or something that I'm thinking of.
yeah, let's hear an example.
Well, so I'm thinking of you can tell I'm on TikTok a lot because I bring up TikTok when we talk. Like clinical trainees go on TikTok lives and talk about mental health, or I'll see them make TikToks about mental health topics or therapy. There was a certain content creator who was a clinical trainee at the time, and they were going on lives, and a lot of people were pushing back on them and saying, "You are providing therapy in these lives, and this isn't okay." So that's where you can kind of get in those sticky situations. And so I'm wondering if that's something that, in your opinion, what you thought about that, and if that's something that should be coming up more. Um, what if, what if the clinical trainee is putting out mental health content that's not, because I think about myself too at that time. I don't think about mental health and mental illness the same way I did when I was a clinical trainee. Now that I'm licensed and farther down the road. So I just kind of was just curious about what your thoughts were on that.
Sure. For me, there's two lines, and both of them have to be crossed for it to come on my radar. The first line is in the same way that I would not jump on the internet in order to Google my client. I'm not Googling or jumping on TikTok intentionally to see what my supervisee is doing
Right,
in
right.
their personal life, right? Or if they have a side gig or whatever. That's for them. So that line has to be crossed. Either someone's bringing it to my attention, the supervisee's bringing it to my attention. There's a grievance, right? There's some
Mm-hmm.
question about it. So that's the first line that needs to be crossed. The second line for me has to it's this blend of scope of practice and intention.
Mm-hmm.
So the first is, does the trainee intend to be providing therapy? Because there there often is a situation where you just don't know. Like like you don't know, the supervisee does not know where the line is as to, is this therapy or is this just doing like standard content? Am I educating? Am I
Mm-hmm.
teaching myself through teaching others? Right? So I would definitely want to hear what their understanding is of it. And then I would evaluate at that point. That second line is crossed. I want to evaluate what the content is and help the supervisee shape it in such a way that they're not violating any ethical or legal boundaries.
Right, right. And I know in especially the ACA ethics, I don't know what other ones say, but definitely keeping your professional and personal stuff separate online.
Yeah. But as the listeners hear me say this, this is the process for me. It's collaborative, it's curious, right? And it's this mutual problem solving. I'm not going to come in with definitive yes and no's about these types of issues because situations are nuanced, right? And having hard and fast rules um, might hurt more than it helps.
Right, right. And I hope you aren't getting the impression that I'm saying, a supervisor should crack down and watch every video or anything about that. But I definitely think it's just something that's interesting that's coming up even more now. And what does that even look like in a supervisee and supervisor relationship?
Well, I don't get that impression from you at all. I think this is a relevant topic. It's certainly recent, and supervisees might take hard lines
Mm,
because they haven't navigated before and just come in saying, well, this is not the way therapy has been done in the past. And just a hard no, hard pass.
yeah.
I certainly have my own opinion on um, what therapy should look like
Hmm.
and how a thing like a live stream where you're actually interacting with a person, named or otherwise, and supporting them through their issues, like personally, with this conceptual um, case, I would say, oh no, we're crossing lines here. Like we're outside of our scope of practice.
Right. I could definitely see um supervisors who don't have that experience that we talked about at the beginning of this maybe jumping the gun on making the decision of like, no, I don't want the liability of that. Or and even going back to, if a supervisee isn't trainable, do they jump the gun on like, nope, you aren't trainable, I'm not endorsing you for licensure?
Well, secondly, for that second piece, you should, like, as a supervisor, you should know you should know this earlier rather than later, so that again you're not causing undue
Right.
discomfort and professional professional barriers like early off. If a supervisor, like, that's your position, okay. There's other supervisors out there, um, and again I think that's why external clinical supervision is so important, because it
Yeah.
provides an option for those who feel stuck um, with, well, the agency only has one supervisor, and yes, they're helping me with the administrative piece to make sure, I'm showing up punctually and I'm hitting whatever metrics they want, but I've got like I want to feel good at the end of the day that I've supported my clients the best that I can.
Yeah. I think it's just all good things to think about when any unlicensed therapist is thinking of finding a supervisor, because also it's such an important, you don't realize it at the time how important of picking a supervisor that it's a good fit for you is at the time, until later on, because you're going to need them for when you apply for licensure. You're going to need them to sign off on all your paperwork, and then you're probably going to need them if you get licensed in another state and you can't apply for endorsement yet.
Oh yes,
This
I've
relationship
seen it.
carries on.
Oh yes, I have seen it so often. I have seen it so often, and it's really important for our listeners. You want to have your ducks in the row as early as you can.
Hmm.
Like, you want to know what is the paperwork that they need to sign and when, right?
Yeah.
Like, do you want to ask it at the time that you put in your 2 weeks notice and you're going to go to another company, that you get that signature before you actually leave the company? Do you want to set up some routine like, hey, I want to log, and every time we do supervision, if you could just initial this, right? Like, you should
Yep.
take it upon yourself to figure out what you need, because there are supervisors who this is not their focus, right? Like, they don't have a system in place in order to support this. It's just happenstance. So
Yeah.
be proactive and set yourself up for success.
Yeah. I think this goes into our next conversation topic of highlighting mentorship as a protective factor for burnout.
Yes.
Do you,
Support, support is so important.
mm-hmm. Yeah.
And the mentorship relationship should be seen as support and not something that's punitive. And
Yes.
right? Going back to that human element, um, anytime anyone is sitting there and exposed to something over and over and over again, there's going to be erosion. So burnout is real, moral injury is real,
Mm-hmm.
and ignoring it or hoping that people are just going to deal with it in silence is not a good way to support someone. So, being or setting an expectation up front, being proactive, talking about how we would support uh, burnout is really, really important. So as I work with supervisees, I do a bunch of stuff. First off, I was part of a study that went into developing the vote tool, and the vote tool actually evaluates a clinic or an organization to a degree as to how much exposure the the staff have versus how the organization actually supports them. And the vote tool looks at a whole bunch of different dimensions, but one of them is this community distributed responsibility, right? The a lot of supervisors would first point to monitoring, that you as a supervisor should support your supervisee in monitoring themselves and doing their own self-care. But when you shift that and allow an additional level of support, which is a community of care, where you you can go to your colleagues and get support, right? You can go to administration and get support and it not be punitive.
Yeah.
That has to be intentional. That has to be intentional. It has to be institutionally accepted, because if not, it falls on you to just take care of your own support. And I'm going to tell you, bubble baths every day can only go so far.
Yeah. And the irony of
So,
corporatized mental health,
oh,
like we've talked about before, I've had those supervisor relationships where there was that dual relationship between them being the clinical director and my supervisor. And I kind of have a hot take on this, and it's just my personal belief based on my experiences. I don't believe if you have a clinical director, I don't think that they should be your clinical supervisor. And my opinion for that is because I feel like it's such a dual relationship. And a lot of the time, the executive director and then the board is going to push certain things on the clinical director. And then it just bottom down flows into maybe some issues, right?
yeah. It's I've got I have a article that's coming out in psychotherapy.net that actually speaks to this, like how there should be dyadic and triadic relationships within supervision, so that organizations aren't conflating and setting up these dual relationships. So I think that one's coming out at the end of fall 2025. So definitely read that one. But another thing that comes from that, that's informed by um, the vote tool, is setting up colleagues to support themselves from a peer perspective in which the organization doesn't monitor. So being able to like say, okay, an hour every other every other day, there's an open conference room. If colleagues want to go jump in there and debrief or talk about
Mm-hmm.
a client caseload or talk about like how they're affected, or even talk or speak out against the practices of the organization, they can do so with some confidence, right? And some support. And it doesn't need to rise to the level of just blaming the organization, but being heard. I mean, we know this from our clients, right? Being heard, being seen, being understood is extremely rewarding and powerful. So why aren't we doing it ourselves?
I think there are some challenges where it is the organization. And the example I'm thinking of is like we have to meet this client quota, like we've talked about before, and then that bottom down going into the clinical supervisee. Well, why are you not meeting your hours? Why are you not? And then you're pushing that administrative piece in clinical supervision when that's not what clinical supervision is for. And if you worked in like let's say private practice, that's probably not going to be the focus of your clinical supervision. There are times where it can be, right? Like can be where clients are leaving for reasons maybe that you're possibly causing, but more often than not, right, you're going to be focusing on how you could support your clients.
Yeah, it's an interesting, I want to use the word fact. It's an interesting fact about our profession. People people come when people come. So there's a lot of issue in corporatized settings when you first get impaneled, like as you ramp up your caseload. And I've always seen it as unfair and really like nonsensical that you're going to put a metric on somebody saying you need to have your 30 client load in the first month. Like that doesn't quite make sense,
Yeah,
right? um, and pushing it with things like marketing, advertising, or supporting people who like don't meet a clinical threshold for support doesn't quite make sense to me.
right.
So that's
Could you imagine telling a client that, like, hey, if you don't show up regularly for your session, I can get written up or fired? Like, could you just
It's
imagine?
interesting too because isn't that the undercurrent? Isn't that the expectation? And we can't say it. It's this hidden undercurrent
Yeah.
that people get sucked down into. No, no, it is interesting. I actually was talking with a group practice that uses a performance-based compensation model where I want to say it's like the first, or they have like these fiscal years, and it's like, okay, we'll pay you this base salary on in your first cycle, and regardless of where you come in. So if you come in at like June, you only have a month to figure it out, but you try to ramp up a caseload, and then for the next entire year, your your base salary is fixed at whatever your performance metric is. That's a lot of pressure.
Wow.
And not just like, you know, competitive pressure in which you know, if you want to make that money, you make that money. It doesn't make sense in terms of you don't have control of who walks through the door.
Yeah. Therapy is not like sales. It's not, we're not selling you something. You are getting healthcare and you are working on yourself. It can't be measured by numbers. And I know that there's a assessment out there. It's like I forgot the name. I'm totally blanking on the name right now. But it's like a therapist assessment that clients can fill out, and it goes over like a broad range of topics that, you know, these are things that I think that the therapist does great, or these are things that the therapist could help me better work on. And the client can just fill that out. And I wonder if that could ever be implemented, you know, and help with that. This is how therapists can get paid better or get a raise, or I don't know. It's just something I have thought about before.
Yeah, I think it's definitely one of these models that is constantly used that's
Yeah.
rarely looked at or changed. Um, and I think that's why the like I have seen a lot of early career clinicians and some mid-career who it's really important for them to move into private practice or group
Mm-hmm.
practice because some of these models are just unwavering in their support of you and truly their support of the client, right? Because if they're not supporting you, how can you effectively support clients?
Yeah. And how do, you know, you're a supervisor, and I'm sure you've worked in those kinds of settings. How do you support your supervisees in that kind of bottom down model?
As a systemic psychotherapist, we are trained to navigate systems. So, first, being able to identify the elements within the systems that are either problematic or creating these barriers is really, really important. And then being able to do what we can within those systems. So, I'm often, like supervisors are often placed as this middle point, this fulcrum in which there's tension from both sides, right? Like top down and bottom
Oh,
up.
yeah. Yep.
So supervisors being aware that they're at this critical flexion point, and or I think it's inflection, right? A critical inflection point that holds a lot of power, and you have a lot of responsibility and obligation to support these two sometimes contentious needs,
Hmm.
right? And the risk of not doing so is literally people getting fired or
Yeah.
people quitting. It's literally the outcome. So supervisors are really important in being able to advocate for the quote unquote workforce needs
Hmm.
while trying to maintain the expectations of for profit models or nonprofit quotas.
Yeah. Yeah, and my hope would be that supervisors could advocate to, and because we see a lot of businesses who are not run by therapists, they're run by, Fortune 500 companies or what have you. And so they don't understand fully what the work is like. And so my hope would be that those supervisors would be in a position where they can, because they are in a position of power, and say, like, hey, like, this is going to burn out your therapist. This is going to lead to a lot of people quitting and all the things. It's not realistic.
Thank you for saying that, which reminds me of an article that I wrote in
Yeah.
Contemporary Family Therapy last year. Digital, I'm sorry, it's privacy and data security in digital health implications for family therapy. And I point out how the tech industry, since COVID, has disrupted this industry,
Mm-hmm.
and that therapists need to be aware of these systems and how how healthcare data is being handled. And in that, I recommend that we, as the practitioner, I'm gonna say it, like charge forward and force your way into those rooms
Yeah.
where these technologies are being developed. Because at the end of the day, the there first off, there's harm to the client, and a lot of times it's unknowing, and the onus is on the licensed professional. It is your liability. You're the one who's going to get grieved, and that has a like a real implication for you
Mm-hmm.
versus some symbolic consequence for a corporation in which they're paying a fine or they're having to make an announcement that a data breach occurred or that client data was exposed,
Right.
right?
Right.
So it is it is that bottom up that you've been talking about. We need to educate, we need to advocate, we need to evaluate these programs to ensure that they're up to the ethical standards that we are beholden to.
Yeah. Yeah. An example of this that it's not very tech completely related, but I recently saw in the therapist subreddit um a supervisor who was talking about they just had become they got promoted to be the clinical director but also was a supervisor, and they were asking about how do I support therapists who are not meeting their quota by paperwork, not like, well, quota, and also how do I support them in completing their paperwork because they're behind in paperwork. And I think just like in that post alone, the supervisor was very open to feedback, open to how can I support when we all know that we're all eating the same shit sandwich. And unfortunately, these some corporations or businesses are going to have these expectations. And so, how can you support them rather than saying, nope, you have to do it this way, which, if you're neurodivergent too, how is that really supporting your neurodivergent therapist? So I think that is just a great point of like supervisors being open to feedback, open to how can I best support our supervisees or our workers when you're in that position of power, and also how can you have that bottom up approach of going back and saying, okay, this is your expectation, but how can we also support our workers?
And it goes back to the reason why I use a mentorship and a teaching model.
Mm-hmm.
You would I was gonna say you're gonna be surprised, but you're probably not surprised. The amount of staff who come to me when I first get an organization who say things like, I was never trained how to do that. Or
Yeah,
I was just kind of thrown to the wolves and just expected to run this thing and document it.
totally.
And right? And being able to say, and of course I'm a systems person, so I like to build templates, support people in doing their notes and documentation so that it's a very easy, like I wouldn't say plug and play, but along those lines where I'm a big proponent. I've ran this training for how long? Which I actually I went to a training and totally jived with the presenter and was like, okay, I'm doing this. And I used their method for the golden thread.
Mm,
And the golden thread is this idea with documentation that within your note, there has to be a contiguous line. And then across your notes, so across sessions with the same client, there needs to be a contiguous line where it's showing progression or it's showing this like the change in the client and or the treatment. And when you think about that, and when you think about how to write notes for an auditor, it certainly
mm.
helps to hit those
Oh,
key
yeah.
points and then move on, and then move on, right? 'Cause I think there's a lot of counselors who are or they're exposed to a lot of information from their clients, right? I think that's
Mm-hmm.
all of us. And
Oh,
being able
yeah.
to
We could
sift
talk about five
through,
things in a session.
right? Absolutely. But being able to sift through like significant or requisite information and jot out a very brief note is the way to go.
Yeah.
And I met when I was working in residential as a paraprofessional, and I was working my way up. Um, I had or I had a directing clinician that I worked under, and she was called the Queen of Brevity, and she knew how to dial her notes down. And of course, a lot of times she's running groups, or she's got what, six adolescents back to back, 6 hours straight.
Mm-hmm.
Um, and yeah, ooh, she did a lot, but she would knock those notes out like by the end of the day. And it was just like, okay, what's the key points? What the key point is, some standard tool like an MSE, and then, what intervention was done, and was there progress, or are they still baseline, or did they regress? And just knock it out and move on. And that has to be trained. That has to be trained
Yeah.
because if not, you're going to be like, you're going to just expect to somehow develop that over a long time.
Yeah. And I was giggling before because I'm the same way. In my clinical training experience, I built a lot of templates for myself. And I built templates and I was working in so many community mental health centers that they were very like pinpointing ways that you are going to write a note for insurance and you're going to write a note if you ever get audited. So I developed a structure of notes that addresses mood and affect, time start of the session, um, and I know it's very medical model and all the things, but that's just to get it done. Because if you're spending more than 5 minutes on a progress note, you're doing too much. You're writing too much. It should just be able to being able to zip it out, and that wasn't something that I was really sat down and told to do. It was the knowledge that I gained throughout my experience.
It's a fair point. I arrived at it this similarly.
Mm-hmm.
I worked with legal involved clients, and
Oh,
I
yes.
learned so much about how to write for brevity, but also how to write so that there is no discovery.
Right. Yep.
Meaning that, yeah, it's only the client that's in that note, and you're maybe talking about relationships, but you don't name anybody else. And that, again, like, unless you worked with that population, you're not going to know, because school certainly doesn't teach that. But, writing for brevity, getting like documenting that the session occurred, and that there was some intentionality behind and rationale behind the instruments that you use, the interventions that you used, and how that works towards whatever the treatment plan is. You can knock those out instead of writing a transcript of what happened.
Yes.
And I want to connect that to that article that I wrote because there's a trend right now as this technology emerges where digital platforms for telehealth
Mhm.
are capturing the entire transcript of what's happening.
Ah,
So
yes.
it's recording what's happening, and then it tries to do the thing that we're talking about that's ineffective and that at points can be harmful, which is to write verbatim or write to some extent that it meanders and it's difficult for you to determine what treatment progress is or what you even did in the session. And that is being trained into these models. So if you want to protect your client and
And your liability.
influence, right? Absolutely. Then you should be learning how to write for brevity
Mhm. And
or
professionally. I
audit,
want to
right?
also say that professionally because we want because you can write vaguely professionally. Like for example, you could say interpersonal conflicts, vacillates, right? Like you can be vague in writing professionally.
See, I hear you. I hear you like categorizing it as vague. But really, if you look back to your treatment models,
Mhm.
this is the lexicon, this is the language, right? If you're dealing with family cohesion, that is an issue, right? Interpersonal conflict,
Mhm.
emotional dysregulation.
Mhm.
We don't need to say like the specific nuanced thing, it informs nothing, right? It's information that is a lived experience that you really should keep lived with the client. And for me, it's an issue of respect and honor. I am respecting and honoring you by making sure that I am talking about it in a way that's for that note, right? Like for the biller, for the insurance, wherever it's going to go,
Yeah.
right? That it's just what happened on my end and what I've got to document versus I'm going to write a transcript of your entire lived experience.
Yeah, and I feel like if your client is requesting your documents to look back on those, the client could feel judged in a way. I feel like sometimes when you if you're doing verbatim, they could look back on that and that could be triggering for them and feel kind of that yeah, that like maybe a judgy tone or something when that's not maybe implicitly there.
It's interesting because a lot of a lot of folks find themselves there, and if there isn't a rationale behind it, there isn't a conscientiousness behind it. Therapists will write their notes under the expectation that you're supposed to capture certain things, and then they don't know that those could be subpoenaed, those
Right.
could be record requested, and then they're sitting there like, oh well, am I saying something that's judgy, am I saying something that if someone read, they would be affected by it, and that becomes kind of the corporate liability where they're
Mm.
like, oh, we don't want to lose this client, make sure you do it this way, versus that human element and that respect and honor of people's lived experiences, that it's not necessary to capture that for you to do effective therapy. And that has to be trained. Like you have to be intentional about that.
Yeah. Yeah, and I think that's just another way that supervisors can help guide their supervisor. And I'm not a supervisor, but I think it would be helpful if supervisors guided their clinical trainees into that like documentation piece of how do we write professionally and also making sure that we're not giving all the details in case of that subpoena or whatever.
Yeah. There's another aspect to this, and it really depends on the type of work that you do, how you're trained, your personal resiliency, the whole nine, which is some people will write notes and it'll be meditative and restorative.
Mm.
Others will write notes and it will be re traumatizing.
Yep.
And I'm talking about the therapist,
Yep.
right? And I have seen it done so many different ways. I've seen clinicians chart in session. I've seen folks that want to do it right or after the session, know I know folks who will do it at the end of the week because they're dreading writing that note and having to re-experience it. Because not like a people have been through things.
Mm-hmm.
Like our clients have been through things, and sometimes writing it down makes it even realer than hearing it, right?
Yeah.
And having practice and some direction around how to write notes, if this is potentially problematic for you, is helpful. And supervisors should be doing that. We should be considering that.
Yeah, I know I've felt like, wow, I just had a really heavy session with my client and now I have to write about it. Like, oh, it can feel such just it can kind of bring you down a little.
Well, I think that's why this approach that we're talking about, where you're sticking to whatever your model's lexicon is, helps to abstract it in such a way that it's less like potent and visceral, right? Like we're looking at it at a technical level instead of, oh, this happened, this tragedy happened, and right, like because that can be rough.
Hmm. Yeah, I think it's just another example of how supervisees can prevent that um, compassion fatigue or the slow road to burnout is that documentation piece. Is there anything else like you would add to that that supervisors can help with to address that? Again, that just that slow road to burnout.
Sure, I think or I'm sorry, it has been my experience. We'll go there. It's been my experience that a lot of us who come into the helping profession, the way that we handle stress is to people please and to fawn. So we
Mm,
have that kind of response. And in that, we become highly agreeable and vulnerable to working way more hours than we should, working past our limits, and really running this endurance that just sets you up for burnout, sets you up for all these things that we're talking about. So, supervisors being able to evaluate that, monitor, and support self monitoring, and then actually hold folks accountable is really, really helpful. Saying things like, take that extra 15 minutes, right? Maybe we shouldn't be stacking your caseload this particular way, right? Maybe we should transfer this particular client. Like, like maybe you need to take a mental health day, right? And it not be this punitive
yeah.
or this like uh, personal onus.
Yeah. I my internship site had one mental health day a month that every therapist got. I thought that was beautiful.
Yes, yes.
Is there any more that you want to talk about? You had identified the self care deficit theory.
Oh, sure. Oh, so for those who um, have access to the academic literature, there is within the nursing field. So I just a bit of self-disclosure. I am a licensed addiction counselor in the state of Colorado, and I often support the nursing board in being able to monitor nurses who have appeared before the board. And I get to hear a lot, which is really helpful from an interdisciplinary standpoint. I get to pull kind of how they do it over on this side of the fence, and they use I think it's Orem, OREM, Orem's self care deficit theory, and I invite everyone to go take a peek at it. You certainly need institutional support to do it, but there are elements that you can take from it that are supportive. And a lot of it has to do with this community of care model that I've been talking about. Setting up your own social networks in which you're not relying on natural supports like your family in order to debrief or process the issues that you're having. making sure that you are in therapy yourself, that you are accessing an EAP, if your company has that, if they have an internal, any internal resources that you can. Being able to effectively disconnect from work is really, really important. And that's in there as well.
Yeah.
But I think the piece that it really hinges on is that the individual onus, like you doing self-care, is just not enough. It's not enough to sit there
Mm-hmm.
and say, okay, it's bubble bath time, it's spa time, go color. Like having like being able to have that shared humanity and know that you belong and that you can affirm what it means to be human. That's the kind of connection that is supportive and like emotionally and cognitively. When you're in the presence of others and it's not this emotional and cognitive tax. So this particular theory does look at that.
Okay, yeah, that is really awesome. And you're right, like we can't just say self-care is taking a walk. It's also having, and that's very LMFT of you, of having those systems in place to also support you.
Thank you. Yeah, and to the that's very MFT. Uh, that's how I got here. So I started off doing paraprofessional work and then
Mm.
moving into addictions counseling, and I worked primarily in residential treatment. And all of us, and I worked with people who were like 20 years strong at the same organization. All of us knew that it's like recidivism occurs soon as the person leaves the milieu, like soon as they leave this place in which they are healed and they're healing, they go back into the community, and it's the community, like it's their environment. It has such a great impact on people relapsing into old patterns because the community supports the pattern. And it wasn't until I found LMFT that I was like, okay, this makes sense. This is the answer to this question that we've been begging for. How long? How do we help more? So being able to look at the system, the ecology, and bring in change in several elements instead of just one person is really, really helpful.
I remember, especially for my experience as a clinical trainee, of just feeling so alone and having those supports, and also like the supports of who get it is also really important. And
Yeah, I know I have personally I know I have personally struggled with talking to other people about my work. Because you don't want to, I mean, I work with a high caseload. I've done over 15,000 full suicide and risk assessments
mm-hmm.
as of today. And it's not a thing you just bring up in casual conversation, right?
Yeah,
People are ready for any of that heavy stuff. And being able to talk to someone who gets it, who, yeah, I guess that's the thing, who gets it or is going to be less affected negatively by it. It's really important. And relying only on your family or your spouse, like that's a lot. That's a lot for anyone.
yep, yep, it is a lot. And so having those supports of people, maybe they are like therapists or maybe they work in just healthcare, can be so valuable. Yeah.
Yeah. The another thing that's really valuable is um, when you do when you do talk to others about your work, and the research shows if you have an optimistic outlook and you look at what went right, when you celebrate your successes, when you are grateful for the things that you can be grateful for, that's restorative.
Mm,
And if you
yeah.
get stuck in just the problem and the wrong, right, and the bad, quote unquote, then you're going to feel that, like you're going to embody that. So taking time to either, reflexively journal where you're writing about the good or being able to espouse and profess the good is really important. And I feel like we don't do enough of it.
And I think that leads us into our last point of training the next generation. and how we do that.
Hmm. Everything that we said today is certainly on the table,
Yeah.
but I think even more so given the climate that we're in, advocacy is really important. I
Mm.
think this newer generation is at or at this forefront in which everything is kind of political. Social workers, it is right there in their code of ethics. It's right there in the bylaws
Yep.
that what they're doing is political. They're there's an advocacy like directive that's
Hmm.
in there, and those who have that identity, that professional identity, certainly has some guidance in how they should be um, shaping the profession and shaping the work that they do.
Yeah.
But there's a lot of other professions in the mental health where we talk about the third rail, this thing that's in the room that it's touching everything, but we're trying to build momentum up on these other rails. And the unspoken guidance is, well, we don't talk about it. We somehow have to take um, anything that's political outside of the therapy session. And with the you know what's going on in the world right now, a lot of people are seeking treatment
Hmm.
either directly because of this, or it's it's adding this additional layer of distress, right? Like it's potentially that final straw that breaks the camel's back.
Yeah.
And being able to like be aware of it and do something directly about it, I think is something that the next generation is going to have to face. It's going to come up a lot more.
Yep. Yep. Advocacy for sure. And also, I keep putting the what like one of the onuses on the supervisors. Also, the supervisors. We can't just rely on the clinical trainees to do that.
Yeah, and it goes back to that like mentorship where there's growth on both ends, right?
Yep.
Like go in as an alliance, right? How can we as a team, right, support this type of change and yeah, and I think um, it is part and parcel when it comes to legal literacy and like supporting what is it like polarized political ideologies in any reform that affects our funding and
Hmm.
our protection under law um, because those scenarios play out like when you're on the ground level and you're doing this daily, these regulations and systems that are in place, they don't always contain or directly connected to what is it you're doing. And when there's a rub there, when there's some contention, then we need to change the system, right? Like it needs updating.
Yeah.
And I think we're in that place right now where there's this new issue that or I shouldn't say new issue. There's an issue that now is disproportionately focused on, and and the system needs to accommodate this new change. We're forced to.
Right. Right. And and the thing too is that I'm seeing a lot of therapists feel like they're running around just not knowing what to do and feeling very dysregulated because of all of the changes that are happening and that are like truly every day impacting our clients and impacting us.
Yes, yes, and I think this again speaks to community.
Hmm.
You are not alone. The responsibility doesn't lie squarely on your shoulders or land directly at your feet. It's going to take a community to change this. So the advocacy is not just, go out there and write a bill, right? It is connect with your colleagues, have discussions
Hmm.
about it, right? Like increase awareness. Um, what is it? If you want to pick it, go pick it. But still, like having open conversations about it and receiving that kind of support and just people knowing what's happening is helpful.
Yeah. Once again, there can be that bottom up advocacy within a company.
Oh yes, especially when it's in mass.
Yeah. Anything else that you're thinking of that the next generation and supervisors should be keeping in mind for their supervisees?
Yes. So, in the same way that legal literacy is important,
Hmm.
tech literacy is important. I don't
Oh,
think,
yeah.
or I think that the days are long gone where we, in our position, can just be users and consumers of technology. We have to have a say in the development of technology. And it goes back to a point I had made earlier, right? About our liability and us knowing what the ethical issues are and supporting these tools in development. So if that means you need to go to a tech trade show, right? Or you need to ask your company, hey, we need to be part in vetting this new technology
Hmm.
that's going to come on, right? Like it needs to have XYZ. So there's different level of tech competency that goes beyond just using it. It's going to have to be developing it. And I think the next generation is primed for it. I'm going to be honest with you. I think they're primed. There's a lot of folks who are entering in the workforce who are very tech savvy and they're very tech aware and they understand how these systems have large scale impacts. And I think we just need to be real intentional about giving them permission and telling them that they should.
Yeah. Ask questions and discern.
Definitely.
Is there any other takeaways that you have or things that we didn't discuss today that you want to bring up that we missed?
I think some good takeaways is I want to empower supervisees
Hmm.
to vet their supervisors. It is okay to be selective. It is okay if the fit doesn't feel right, even if you can, if it's intuitive, that's fine. Um, and for those who are in situations where you're just assigned a supervisor, if you can get an external supervisor, if you can afford it, do it. Even if it's just like a what is it? Every other month you're doing a group supervision with someone else. Reach out so that you can get a different
Yeah,
perspective,
I
a
love
different
that.
take.
Yep.
So I think that's a good takeaway. Um, you should like certainly ask or don't be afraid to ask when you don't know. I know it's really hard because again this dual role of like this administrative supervisor that the vehicle, the mechanism is punitive, like it's consequence based, versus more of a growth, like a yeah growth mechanism. Um, if you can't talk to them directly about the issue, go to another supervisor, go to an admin, like whoever it is that you can reach out to and get that support. Um, I think there's another good takeaway is that there are some corporate realities that we have to navigate,
Hmm.
but that in mass we can change systems. And I know that is cliche, and we hear it a lot. But I think the thing that we don't hear is that these institutions and organizations are, in fact, upheld by people. So if you're holding it, you get enough of you guys, right? You can reorient it, you can change it, you can adjust it, and we should.
Yeah. Ask your supervisors, ask your workers, ask your therapists instead of treating it like it is a marketing business model.
Yes. Yes. Absolutely.
Any other peer review articles? I know you have quite a few that you didn't share today that you want to sneak in.
I got a bunch, I tell you. The actually, I'm really proud. I just had two edited book chapters accepted in a book called The Startup Generation: Shaping Future Through Psychology and Business. And I
Very
wrote
cool.
two articles. One was or book chapters. One was Unshakable: The Psychology Behind Fearless Entrepreneurship, which guides folks in really like shaking free of imposter syndrome and going out there, and if you want to start a practice, you start your practice. And the the second one I have is Strategic Planning for Gen Z and Beyond Startups, Lessons from Haley's Strategic Family Therapy Model. And in that one, I bring in um, some, think that one I bring in a case study. Well, you're gonna have to forgive me. One of them I look at. I think there's like five or four different cases. Like Jojo Siwa's is one, and there's some younger influencers and how they went about starting their business and what some takeaways are in this new consumer era. And the other one, I did a platform that is more like eco consumption based, so that the business that you start and the products that you sell are considerate of the things that these newer generations, including me, uh, really, really respect and admire, which is businesses that are conscious about climate impact. So those are two that folks could read.
That is awesome. Congrats, though, on getting it accepted. That's so exciting.
Thank you. Yeah, it was invited too, which is great. Like
Oh,
someone,
so
the
cool.
editor actually reached out to me and was like that. Yeah, same thing with I'm or I was invited to work on strategic family therapy chapter out of the what is it? Rutledge's Intro to Marriage and Family Therapy. So like literally a textbook that
Yeah.
a lot of MFTs are gonna be looking at. They revised it to the third edition, and I rewrote that chapter. Um, so that was exciting.
Yeah. I'm sure that feels just so good.
Oh yes, but yeah, just like I'm available on or you can search me on Google Scholar or whatever platform you use like EBSCOhost. Like go to the library, you'll find me.
Hmm. Anywhere else where our listeners can find you?
Yes. So I think the a good place to start is easydoesitcounseling.com, and that's easy EASY. And we have a YouTube channel which is by the same name. That's our teletherapy practice. It's Easy Does It Counseling. And on YouTube we have guided meditation and guided imagery videos. We've got some psychoeducation on there. I've got an ADHD toolkit for those who are looking to manage some of the symptoms that come along with living with it. And we've got, and I've been doing these weekly meditations. It's a bit of a start your day off with some intention. It's they're about 20 minutes. They're released every Monday. So feel free to jump on that. And then, yeah, I think Google Scholar is or the yeah is or LinkedIn. I'm on LinkedIn, so you can jump on LinkedIn and find me.
Yeah. Awesome. Well, thank you again for this insightful discussion, especially, with all of your years of experience and experience as a supervisor. For me, it was very insightful, and I hope um, definitely an educational piece for other people who are looking for a supervisor or supervisors now and parts that they can use for their own supervision.
I'm also available for external clinical supervision, and you can reach me on that on easydoesitcounseling.com.
Yeah, and do they have to be in the same state as you, or could they be like, say, somebody from Minnesota?
It's that's a good that is a good point. So for licensed marriage and family therapist, you have to have an approved supervisor, and it can be anywhere in the world.
Awesome.
So for LNFTs, feel free to reach out to me. As for state licensure, you certainly want to get someone who's licensed in your state, and I'm licensed in four: Alaska, Colorado, Hawaii, and Louisiana. So if you're looking for a supervisor in those states, feel free to reach out to me.
Yeah, awesome. Awesome. And we can already get kind of a feel for what supervision looks like with you.
Yes,
Yeah.
and I hope it's inviting.
Oh, absolutely. I mean, I feel invited. I mean, where were you? I was All right. Well, anything else that you kind of want to discuss before we head out here?
Yes, I almost forgot. So you can jump on Amazon.com and look at my book series. I have two book series out. I've got a um, nine book collection, which looks at emotional regulation with some like practical tools that you can use. And it also situates you on a journey and takes you through nature in the woods as we ask reflective questions of you, and you can journal. So they're kind of like guides and a workbook. So there's nine of those, and they each have a different emotion
Mm,
that you're experiencing, like fear or betrayal. So take a peek. I also have a four book series, and this one is more substantive. So it is how to identify certain emotions, and especially for folks who are neurotypical, I'm sorry, for that are neurodivergent, it gives you like like what's the somatic experience, what the emotional experience is, what the cognitive experience is, and helps you identify it, and then work through it to do some processing. And then I have like in that collection there is a mixed emotions book that talks about some of the emotional states that we have that doesn't quite have language for. Um,
yeah.
and there's two accompanying workbooks out of that four book series.
Awesome. And that is just your name, or how do you find that on Amazon?
Oh, good point. So you can search Ezra Lockhart, EZRALOCKHART, or it is the Emotionally Empowered series and the Emotionally Yours series.
Okay. Awesome. Thank you for sharing that.
I'm excited. I hope folks get excited about it.
Yeah, that's so great. It's very needed too, especially the emotional piece. All right. Well, thank you again for coming on. I so appreciate all of your expertise and everything that you can share. I mean, you just have a wealth of knowledge, and it's so wonderful that you can share that.
Well, thank you so much for having me on today. It was a pleasure talking with you. It's always lovely. And we'll clap for next time.
All right. Thank you. And we'll see you next time.